Dr. Linda Park here. Today I'm going to talk about myofunctional therapy. What is myofunctional therapy? Well, it's a whole system of thinking where we consider tongue function. Tongue function is vitally important for our health. And it's something that, because of modern living, once again, has gotten distorted. Our tongues don't function the way they're supposed to. Functional swallow is vitally important. What is a functional swallow and why is it a problem? Well, nowadays a lot of children use a pacifier or a soother when they're young, and babies obviously. And it's something that's just given to them right after delivery. And they're in the nursery and they've got this stick in their mouth that's very soft and they suck on. And it's important for children to do that and infants to do that. But if it's the wrong shape, if it causes the wrong function for the tongue, then it sets them up for a lifetime of problems. And then as we get older, then it turns into a weak tongue. We have softer diets and lots of toxins, and our lifestyles are different than they used to be 500 years ago. So we have tongue function that is not good enough for optimal health. So one way to change it in childhood and adulthood is to try this. And it's something that I was exposed to recently, actually from a friend of mine who discovered it. But it's from a company called Remastered Sleep. I'll post a link to their website in the caption below. But what it does is help with correct tongue function and the functional swallow. So by doing that, what you do is the tip of the tongue goes in the front where it's supposed to. You bring the water in, it sits in a little bowl, and then you put the tongue up to the roof of the mouth, teeth together, and then you swallow it down. So all of that helps to create a functional swallow. A patient and a friend of mine used this straw for a couple of months and decreased her CPAP use. She went from, because she was mild, wasn't a huge issue, but she was struggling with sleep and was not healthy because of it. She had 5 apnea events per hour. So she got a CPAP, which she hated, and discovered this. With use of this, after a couple of months, she went from 5 events an hour to 0. And that's just by making the function of the tongue, and that is all the way down here too, which affects the airway. It improves the function of the tongue so that you can have a better airway when you sleep. So that's the purpose of it. And you have less snoring and a stronger airway, daytime and nighttime. Thank you so much for taking time to watch this video. I hope you found it helpful and informative for living a healthier life. If you did, hit like and subscribe and wait for more great content.